Welcome to Unpacking the Home Health Star Ratings webinar, hosted by the Visiting Nurse Associations of America. Today's program will be presented by Jillian Martin with CliftonLarsonAllen. I'd like to turn it over to Corey Rutledge to introduce today's call.
Okay, thank you, Heather. Good afternoon, everyone. I'd like to welcome you to today's webinar related to the Home Health 5-Star rating system. And before I get into things, I just wanted to give a quick reminder on the relationship between CliftonLarsonAllen and VNAA. Clifton Larson and VNAA are partnering this year, and really the purpose of this is to ensure that VNAA's members have all of the tools they need to ensure financial success of their home health agency. Clifton Larsonallen provides a lot of services and has a lot of insight related to the financial world of healthcare and home health, and we're excited to share some of that knowledge and insight with the members of VNAA. And we are doing that through a variety of educational sessions, including this webinar, as well as some white papers and tools that we'll be sharing throughout the duration of 2017. That education is really focused around 3 themes. As we pulled together our programming for VNAA for 2017, we thought that it would be pretty important to share some of the thoughts that we have related to optimizing performance in today's fee-for-service environment. That's the first theme. The second theme is around communicating your value proposition. And finally, the third theme is around achieving success in alternative payment models. And today's education, I think, really fits in well with the last 2 of those themes. And so I'd like to turn it over to Jillian in just a moment. Jillian is a nurse consultant with Clifton Larsonallen, really specializing in clinical documentation, and she really enjoys sharing that passion and insight with clients around the country. So Jillian, I'd like to turn it over to you.
Thank you, Corey. Good afternoon. My name is Jillian Martin with Clifton Larsonallen. We're going to be discussing the Home Health 5-Star rating today, and we're going to use Nursing Home 5-Star and Nursing Home Compare as a basis to show us what we may anticipate in the future that might change with Home Health 5-Star and how that's going to relate to alternative payment models and systems. So we'll do a brief overview of the star rating and the Home Health Star rating, what we know about the history of Nursing Home Compare, and where that can guide us for Home Health Compare. We're going to navigate the Home Health Compare site as well as its data sites, which are really the key to utilizing the Home Health Compare site. What do we do with that information once we have it, and how should we be managing that data? So the next 2 slides are a list of terms and abbreviations that I will use throughout the presentation. I will spell them out the first time, and then I will continue to use them as abbreviations throughout the presentation. If you have any questions on any of these terms or abbreviations, you can ask them in the Q&A session at the end, or you can feel free to email me at the end as well. So what is the Home Health Compare 5-Star rating system, and what is the purpose of it? So CMS established Home Health Compare website on the Medicare.gov website as a tool for consumers to use when choosing a home health care provider. This is what they say the purpose of it is, and they designed it so it was easy to access, easy to look at, a convenient source for consumers, and they also made it a convenient source for agencies and organizations to keep track of how they're doing as well. In developing it, CMS indicates on the page that they want you to not think of it in the same reference as you would a hotel or a restaurant star rating, but they did use the star rating so that it was a recognizable rating system that people could easily navigate through. So Home Health Compare has information about the quality of care provided by Medicare certified agencies throughout the nation. And Medicare certified means that the home health agency is approved by Medicare and meets certain federal health and safety requirements. So it means that they will continue to meet those requirements. And in 2017, with the new conditions of participation, it's going to be very important to make sure that you stay on top of what those conditions are. And this second bullet here is really what the consumer intent is. It helps you learn how well the home health agency cares for its patients, how often that agency uses best practices when caring for its patients, whether they showed improvement, and it tells you how the patient feels about that care experience. Along with Home Health Compare, there are some other 5-star rating systems. We have Physician Compare, Hospital Compare, Inpatient Rehabilitation Facility Compare, Dialysis Compare, Nursing Home Compare, and Long-Term Hospital Compare. They all have the same concept. CMS wants to evaluate certain components of how care is delivered, the quality of that care, and what patients say about that care. And it's publicly available data. And by public in this instance, we just mean that CMS is trying to be as transparent as possible with how they're grading this and how they're making the information accessible. The oldest of these systems is going to be Nursing Home Compare, which is why we can use it as a benchmark to determine where the rest of them are going to go in the future. There are two components to the home health rating system. We have the quality of patient care rating and the patient survey star rating. The quality of patient care rating includes 9 of the 24 publicly reported process and outcome quality measures. Now what this means here is that there are 24 quality measures that you can find on Home Health Compare. Only 9 of them are actually used in the calculation for the star rating. There are 3 process measures and 6 outcome measures. So this component of your 5-star is assessing the quality of care that you provide based on standardized information. The information comes from 2 places. It comes from your Medicare claims data, and it comes from your OASIS assessment. And OASIS stands for Outcome and Assessment Information Set, which we will discuss further in a few minutes. CMS developed criteria that they wanted to put together so that the measures would meet all the standards that they wanted and they were easily reproducible. So the 3 process measures are going to be timely initiation of care, drug education on all medications provided, and influenza immunization received for current flu season. Those are going to come directly from the OASIS assessment. The outcome measures they're looking for improvement in the following areas: ambulation, bed transfer, bathing, pain interfering with activity, improvement in shortness of breath, and do they have any acute care hospitalizations during their episode of care. So what they're looking for in this outcome section is, did the patient show an improvement or a change because of the care that you provided? And did they have to go back to the hospital at all during that episode of care? I'm not going to go into great detail about these measures because I think it's more important to understand where that data comes from and how to use that data. So again, I want to reiterate that this data is coming directly from your Medicare claim, so the acute care hospitalization information is going to come from your Medicare claim. And then the rest of the measures are going to come directly from your OASIS form. And the OASIS assessment is filled out by direct care staff. So as an example, this is one particular section of the OASIS assessment that goes towards that quality measure, and that would be the medication portion of that. And this is just a small portion of what has to be filled out. So this is coming from what the nurse is filling out based on their interaction with the patient. And then what the nurse fills out then gets sent into the Medicare system, and that's how it gets evaluated. So a 4 or 5-star rating in your quality of patient care means that the agency performed better than other agencies. A 1 or a 2-star means that they performed less on those measures. And across the country, most agencies fall in the middle with 3 or 3.5 stars in that quality of patient care information. For home health today, this is okay. Being a 3-star, if everyone is in that, most people are in that range, and that's fine. The information we can learn from nursing homes about this is, unfortunately, 3-star Nursing Home Compare is the new de facto 1-star, which means that unless you have a minimum of 3 stars in Nursing Home Compare, there are many programs that you're not being able to participate in. You won't have the option to become a part of an accountable care organization. You won't have the option to join in a comprehensive joint replacement program. You won't have the option to have a Medicare 3-day waiver so you can take patients directly from the emergency room. So in this instance, it's all about the 3s. You need a minimum of 3 stars to participate in that. And obviously, 4 and 5 stars are really taking preference over the 3 stars. So 3-star today being average is fine, but in the future, being a 4 or 5 is really probably the aim of what home health agencies should be doing. So the OASIS assessment was developed in the 1990s by the University of Colorado at the request of CMS. It's a standardized data collection tool with 100+ items or data points, and it's collected at the start of care with 60-day follow-up of care and at the end of care. It's collected at various time points throughout that episode of care. It's developed to measure patient outcomes. That was its initial purpose, was to have a standardized way to measure what was happening with patients based on the care that they were receiving. With the Balanced Budget Act of 1997, there was a push for a prospective payment system and utilizing the OASIS as the foundation for that, and that went into effect in 2000. The OASIS is also used for survey of home health agencies, and that will become increasingly important as well with the new conditions of participation. And the OASIS is not only used to monitor the quality measures, but it's obviously the source for quality measures. And much like the MDS, the minimum data set, which is the nursing home version of the OASIS, it has been extensively tested and refined since its inception, and you can expect that that will continue, especially with the Impact Act, and there's a big push for standardized assessments across all continuums of care. And what that means is, so this particular section here of the OASIS, which is section GG, is functional abilities and goals. This is the first section of either the OASIS or the MDS, the minimum data set, that utilizes the same language across both of those continuums. And it is because of the Impact Act. In 2012, the Office of the Inspector General report on home health agencies said that home health agencies did not submit required OASIS data for 60% of their claims, and that 15% of those claims were submitted late. The OASIS plays a very crucial role in survey, in star rating, and going forward will play a crucial role in quality reporting programs and pay for performance. So in order to have it calculated towards your star rating, you have to submit it, you have to submit it timely, and you have to check it for accuracy. The data that CMS receives is only as good as the quality of the data that you send them. So all Medicare certified agencies are potentially eligible to receive a quality of care rating. The agency must have 20 completed episodes of care for data for each measure to be reported. In a completed episode of care are paired OASIS assessments, meaning for the same resident, with a start or resumption of care assessment and an end of care assessment. This data, as calculated, was first reported on Home Health Compare in July 2015, and it is updated quarterly. The next component of the Home Health 5-star rating is going to be your patient survey star rating, or the HHAs. So it's Home Health Consumer Assessment of Healthcare Providers and Systems. And according to CMS, it's to help a consumer quickly and easily assess a patient experience of care. The information comes directly from the patient when they fill out a survey post-care. There are 4 overall measures of patient experience and 1 summary rating. So these measures here, the composite measures and the global measure, they come directly from questions on the survey. And you can see, as an example, the care of patients composite measure. They compile the data for 4 separate questions to give a percentile for that particular rating. The survey is conducted by a third-party vendor, and that vendor must be approved by CMS. More stars equals better satisfaction, and the more people you can get to fill it out, the better your chances of improving your star rating. And the vendor that you utilize is only as good as the timeliness and accuracy of the information that you send them. So if you don't send them all of the required information for the survey to be sent out to the patients the first time around, then it prolongs that survey getting completed and getting completed accurately. So this is a view from Home Health Compare and how star ratings look for the patient survey. And this is a main area that's different from Nursing Home Compare. Nursing Home Compare does not have a patient satisfaction survey component to it. I'm sure that's going to change in the future, but as of today, that is not something that they have been able to do. However, hospitals and physicians do have the patient survey component. And if you yourself have accessed any portion of the Medicare system as a patient in the last few years, you've probably received a survey in the mail that the information that you fill out and send back goes towards this particular star rating for that agency. This is further detail about information that the survey is collecting. So a lot of the information that you can find on Home Health Compare can really bring you into so many different sections of education and knowledge. So this here is telling you what information they're collecting in the survey, why they're collecting it, when they're collecting it. It's asking a series of questions about how the patient felt about their care experience, and it's compiling that data. To get a patient survey star rating, home health agencies must have at least 40 completed surveys over a given 4-quarter period. So now that we understand the 2 components that make up the star rating, let's discuss why it matters. So we want to know who's looking at the data, who's looking at the rating, why they're looking at it, what they're doing with that information, and when are they looking at it. So we have a pretty good idea of who's viewing the data as far as nursing homes go. We know that a lot of hospital systems, accountable care organizations, and competitors, as well as hospital discharge planners and marketers, are using the information on Nursing Home Compare to make determinations about where to send patients. The same can be said for Home Health Compare. It's being used by many other outside sources besides its original intent. It's very rarely used by the potential consumer in the capacity that it was anticipated to be used. Why are they looking at the data? They're looking at it to choose a preferred agency to work with, whether we want to use home health or nursing homes as that agency. They're using it for a marketing or a business plan. Hospital systems are using it to determine whether they're going to include or exclude nursing homes into comprehensive joint replacement programs and accountable care organizations. And they're looking for a harmonious balance between the quality of care and continued success as an organization. So from an insider's perspective, as someone who should be evaluating your own star rating, if you are an organization and you feel that you give high quality of care, is the information that the rest of the world's seeing proving that? And if it's not, then you need to take a closer look at it. And as home health care moves toward changing payment models, and as the regulatory environment continues to mature, the things that nursing homes have been facing over the last decade will be what home health agencies are going to face down the road. So we can learn from the successes as well as the mistakes from nursing homes and Nursing Home Compare to try to predict what we need to be ready for from a home health agency perspective. Home health timeline. So I have a home health timeline and a skilled nursing timeline, and a lot of it is just to show that there are correlations and comparisons and that we can continue to expect changes. So in 1990, the OASIS form was developed. In 1997, the Balanced Budget Act proposed a prospective payment system with the OASIS tied to it for home health Medicare payments, and that went into effect in the year 2000. 1999 required that the OASIS data be collected and transmitted for all Medicare and Medicaid home health care patients. In 2003, there was a subset of quality measures that was posted on Home Health Compare, so there was no rating to go with it. It was just data and informative. In January 2010, there was revised OASIS data information, meaning they changed some questions, they changed some coding information, they changed some sections of the OASIS. In July 2015, the quality of patient care component, the rating, was added to Home Health Compare. And in January of 2016, the patient satisfaction survey rating was added to Home Health Compare. Now in 2017, there are new conditions of participation, and looking forward, I would expect that there will continue to be changes to OASIS. So this timeline is going to continue on with a lot of different paths off of it. If we look at the skilled nursing timeline, I have more years here, and there were even others that I didn't include because there have just been so many changes over the years that I just picked the ones that were at the top of the list. So in 1987, OBRA, which is the Omnibus Reconciliation Act of 1987, started the MDS 1.0, which the complete thing was 10 pages. It was developed by the federal government and a nursing home in Massachusetts. And again, it was developed for the same purpose that the OASIS was, as a standardized assessment tool. In 1995, the MDS 2.0 came out, and it added more components to it in different ways to assess patients, as well as care planning regulations. In 1997, it was mandated that that be completed and submitted for all patients, and that was also the same. They proposed a prospective payment system to tie the MDS to Medicare payments. In 2008, a 5-star rating system was added to Nursing Home Compare. Prior to that, the information that you could find on things like Nursing Home Compare and Home Health Compare was the name of the organization, how long they've been certified, their address, who owns them, things of that nature. It wasn't until the late 2000s that things started having a rating attached to it. In 2010, the MDS 3.0 came out, which is now 40 pages. It has over 1,000 data points, and the manual itself is over 1,300 pages. In 2014, there was a New York Times article that said nursing homes were using 5-star rating information to game the system. Once that article came out and published, CMS decided they needed to reevaluate the system because there could not be that many facilities that could actually be a 5-star facility. So in 2016, Nursing Home Compare had updates that added Medicare claims data, and it changed the way that some of the calculations were done for 5-star nursing home. They added section GG to the MDS minimum data set as part of the Impact Act, and a requirement to meet the quality reporting program. In 2016, November of 2016, phase 1 of the new requirements of participation for nursing homes, or the mega rule, was implemented, and that will be rolled out over a period of 3 years. And in 2017, October of 2017, we anticipate more changes to the MDS. Now, embedded in this are continued changes to the MDS, to the coding, to the number of sections, to the number of questions, to the data that impacts your quality measures. And we are anticipating continued yearly updates to the MDS as they move more towards having the same language and same wording as other standardized assessment tools across the continuum of care. So this is a brief slide on Nursing Home Compare, just so we can utilize it as a reference point. So there are 3 separate domains to how the Nursing Home Compare 5-star rating is calculated. You get a star for your annual survey. You get a star for your staffing ratio. and you get a star rating for your quality measures. And your quality measures, again, are MDS-based and Medicare claims-based. Then there is a multi-step process to get an overall star rating. Your quality measure star rating is updated quarterly, and your star rating for your staffing is updated when you have that survey. Star ratings are distributed per state due to fluctuations in survey process. So what this means is that a 5-star facility or 5-star nursing home in Texas is not going to necessarily be the same as a 5-star nursing home in Rhode Island. There are different calculations based on the state. And only 10% of facilities or nursing homes per state can have a 5-star. The worst 20% or the bottom 20% of nursing homes receive a 1-star, and all the other nursing homes fall in the middle categories with the same distribution number. And the same as Home Health Compare, there are a lot of other quality measures on Nursing Home Compare that are just not added into the calculation. So learning from Nursing Home Compare. As CMS explores ways to use the OASIS assessment and the patient satisfaction survey in a pay-for-performance system, the information on Home Health Compare will become the source for those changes. Once the MDS, or the minimum data set, became tied to Medicare payment, it was really the start of quality for payment monitoring, even if they hadn't implemented that as a system yet. Since the initial reason for the MDS, as well as for the OASIS, was a standardized assessment to measure and keep track of patient outcomes, it was only a matter of time before that became a rating system. So there'll be continued changes to the components of the system, meaning Home Health Compare will add and remove sections. The OASIS will add and remove sections. They may change questions on the survey over time. Quality reporting program will have different requirements that may or may not be impacted by your 5-star. The Impact Act, as it continues to move forward, they have a very specific timeline of when they want things changed, and that will continue to drive what changes happen to the OASIS assessment. And payment reform program participation, this is probably one of the biggest ways that we can look at what we can learn from Nursing Home Compare. So even though nursing home payment is not driven by your 5-star, it is driven by the ability to participate in some alternative payment models. So becoming a part of an accountable care organization or being a preferred provider and being asked to join the comprehensive joint replacement program can drive your payment in a good direction. But you need a minimum of 3 stars to participate in those. So that can also point us to what we would expect to happen with home health down the road. So now we want to talk about navigating Home Health Compare. We have our home page, which is going to give us detailed information. This is the main page that you see when you go to Home Health Compare. And there are a lot of different options to click on here, a lot of different information to find. And this is also where you're going to find your data pages. And really, those are the pages that are going to matter the most. So this is what a search is going to look like at Home Health Compare. You get more detailed if you pick a few titles and use the word compare, and really that's what the consumers are doing. So from a consumer perspective, when they're going to Home Health Compare or Nursing Home Compare, they're taking a few options of agencies that they have in mind, and they're putting them together using the compare option. And from there, they're using the big picture of what do these stars look like to me? How do I view them? Am I comfortable with the facility that's closest to me, even if it's only 1 star, or am I willing to drive a little further, or do I want an agency to come to me if they're 1 star versus one that's a 5-star, but they might not see me as quickly as I want them to? And it is these data set pages that are really the gold mine. These pages give us much more detailed information than the front or the home page. as agencies and organizations or small business owners, or more importantly, the ones that are being graded on this information, this is where you should be spending your time reviewing your data and the data of your peers. So these data pages give us information like which aspect of home health compare is most popular by view type, meaning how often is it looked at. As you can see here, the general home health page is the most popular. This is because everyone has to go here to start their search, so this is not a surprising number. What is interesting and helpful on this page as an example, as we can see, the most viewed data is the home health patient survey with 57,269 views. And far behind that is the quality of patient care data, which has only been viewed 19,182 times. This is a big difference. So what this is telling us is that people are more concerned with what other patients are saying about the agency versus what the standardized assessment quality measures is telling us. So one of the first steps for your organization is to utilize this data. Where does your organization look? What does your agency look like in these numbers? This page here is also going to be a very useful page as I get to the next couple slides and I discuss preview reports. So this slide here is going to give you your local state contact person, which is going to be important to be in touch with them should you have any discrepancies in your preview reports. So I've spent some time, and I recommend everyone else spend some time navigating these data set pages. If you look over on the right, you can see that there are so many filter options. And if you look at a previous slide, so you can download it as a Microsoft document, you can download it as a CSV flat file, you can get archived data, you can get supporting documents. There's just a lot of information that you can find on these Medicare data pages. And you can click on each of these here and get further information on how the data was collected, when it was collected. You can sort it based on dates. There are just a lot of different options you can do with these data pages. And the agencies or organizations or hospitals or nursing homes that are in a best practice system are using these data pages on a regular basis. So preview reports. So Home Health Compare, or CMS, distributes these reports to each agency. The reports are available 3.5 months before they're published. And the reason for that is because it gives you the opportunity to look at the data, to review the data, to check it for accuracy and validity. And if you have proof or a way to show the Home Health Compare CMS website that the data they are going to publish is inaccurate, you have the option to request a change. Now, in my experience, very few people are requesting a change, and I think that's because very few people are actually utilizing the preview reports. Home Health Compare has a separate section that will tell you how to retrieve your report and how to request a change. CMS often emails generally when these reports are available. And if not, you can always go into the system and request it. And if you follow the instructions, it will tell you. Other sites that I mentioned earlier, like Physician Compare and Nursing Compare, also have preview reports that can be viewed. So this is what your preview report is going to look like. And this is going to be your quality of patient care star rating provider preview report. It will give you information about dates, the date range that they're using for claims and the assessment, the OASIS assessment. And if you utilize this preview report, it is even helpful in understanding the data that they're collecting, and why they're collecting it, and what they're doing with it. So instead of spending a lot of time navigating through the Home Health Compare link after link after link, if you print out this report and read through it, it is very clear and easy to understand and really easy to follow the information on it. And again, it will give you instructions on how to request a change. So now we're going to discuss best practice in nursing homes and what they're doing to either fix or maintain a good star rating. So the first step is to know your 5-star rating and when it's going to change. The significance to this is that if you don't know the star rating to begin with and the breakdown of that star rating, and especially in nursing homes because they have so many different components, then you're not going to know if that information is accurate. You're not going to know when you're susceptible to that information changing, and you're not going to know where you stand in reference to either your peers or to being a preferred nursing home to receive discharges from a local hospital. You need to know the components of your 5-star rating and where that information comes from. So the quality measured data is coming from your MDS as well as your Medicare claim. Your survey data is coming when you have your annual survey from the state. And your staffing data comes directly from paper that is filled out during that survey process. Currently, the staffing data is done on paper and it's only updated annually with the survey process. Looking forward into 2017, we anticipate that this is going to change. Also, we have no definitive information on that yet. And as somebody who works in a nursing home or who has administrative oversight in a nursing home, it's important to know all of these components and when you can expect that they're going to change. So when was your last survey? When are you in your survey window? Was it a bad survey? Did you get a bad star rating when you had survey? Have steps been put in place to improve that for the next time? And when we're looking at MDS data, it's important to note that based on many, many studies and many consulting organizations, the MDS itself, so the minimum data set form, again, has over 1,000 data points, but it also has a 25% error rate. We know that because there are a lot of organizations out there that are auditing that process, and they're auditing its accuracy and validity. And in actuality, that number could probably be higher because there are plenty of other organizations that are not having that data analyzed. So with a 25% error rate, one of the first things that you have to do is you need to pull your quality measure report and you need to look at it. Does it look true? Does it look accurate? And by correct, I mean, as an example, does your quality measure report indicate to you that you have an unusually high percentage of falls, like greater than 80th percentile? And if you don't think you have that many falls, then you should be addressing those types of things from the documentation perspective as well as from the preview report perspective. And with that MDS, you need to mitigate that error rate as much as possible. And how are you going to do that? You're going to make sure that you have the right staff in place. And whether that means that there is certification process involved, or there's corporate oversight, or there's regional oversight or administrative oversight. And that also means that there needs to be ongoing education. With so many changes and so many continued expected changes, you can't just have the assumption that what we do today is going to be the same and as good as it is for what they're expecting tomorrow. You know, when we're talking about best practice, it can refer to a number of different things. For those of us that are clinicians, it can refer to direct patient care and evidence-based practice. For those of us that have a business background or focus, it can mean what are the best organizations doing that we can or should be doing. And the information here can kind of bring those together. And how can the agency or the oversight of the agency impact your star rating, your outcomes, and your overall business practice? You need to have an evaluation system. You need to know that the data that is getting into Home Health Compare or Nursing Home Compare is accurate. You can do this by utilizing internal and CMS reports. You can use those back data pages that you can find on all of those Compare websites. You need to utilize your preview reports. And even if they're accurate, you need to know what is going to happen in the public view of your 5-star rating in those 3 months when it's reported publicly. Do you have a QAPI system in place? And by QAPI, that means quality assurance and process improvement. And when we get to the best practice home health, I'll go into that in a little further detail. And then this last slide, the CMS ANACS communication. What I mean by this is, for nursing homes, there's an organization called the American Association of Nursing Assessment Coordinators. Them, hand in hand with CMS, have written the manual on how to complete the MDS. They provide certification in the MDS process. They are a direct link between CMS and MDS nurses on anticipated changes, common coding errors, and things of that nature. So by subscribing to an email list, either through an organization like ANAC or through CMS, then you can be up to date and proactive on changes that you will be coming on the horizon, not just fixing it after the fact. So best practice home health agency, a lot of that is going to follow along that same line. You need to know your star rating. You need to know the components that make up that star rating. Do your quality measures actually paint the picture that you think your agency has? Is your patient satisfaction survey a problem for you? Are your percentages really low and you need to address that? When looking at the OASIS, which is where a lot of your quality measure information is going to come from, we're going to analyze it the same way that we analyze the MDS. It probably has a very high error rate. What type of oversight exists for that process, and what type of education are we offering to the people that are filling that out? Now, the difference between home health and nursing homes is that there is one designated person at a nursing home to fill out that particular form. The OASIS form is filled out by the direct care staff. And how much OASIS education have they had? Do they understand the significance of that document, or is it just another piece of paper that they have to fill out during the delivery of their care? In the patient satisfaction survey, you should be pulling that information to see where you stand in general, where you stand in comparison to the state and national average. Is it all components of the patient satisfaction survey, or is it just a few pieces that you can really narrow down? You need to be looking again at your preview reports. You need to have a QAPI system in place, and this kind of goes hand in hand with an oversight system as well. So QAPI is really QA, PI. So QA is going to be your quality assurance. You need to be monitoring the quality of care, the quality of documentation, the validity of documentation, and the integrity of that documentation. And your process improvement, what are you doing to fix it? If you have found an error, if you have a certain area where your quality measures are low, if you're not in fact showing any improvement in patient care, what processes are you putting in place to fix that? And not only do you need to implement a QAPI process that starts from an oversight perspective, you need to make sure that that information gets disseminated appropriately. And what I mean by that is the information that they're collecting for the quality measures, the medications that the patient's receiving, or whether they're improving in ADLs like bathing and bed mobility, is coming directly from the nurses, the personal care assistants, the certified nursing assistants that are providing that care in that person's home. What are they filling out? How are they filling it out? Do they know why they're filling it out? And if there are changes, is that information getting to them in a timely and clear manner so that they can understand the steps they have to take to make those changes? And again, you need to make sure from a home health agency perspective that you're in touch with CMS or you're in touch with other local, state, or federal organizations that can provide you with updated information on when things are going to change or what might be coming down as far as changes to quality and payments and payment reform and what you can expect for data analysis. Currently, they're only using portions of the OASIS data. The same, they're only using portions of your Medicare claims data. Will that change in the future? And one way to know and stay on top of that and to be able to analyze that is to have a system where not only someone in your agency or organization is in touch with CMS, but they have the ability to understand that information and then pass it along in an appropriate manner. So some key takeaways here. So star ratings only apply to your traditional Medicare, Medicaid certified agencies. Now that doesn't mean that your Medicare Advantage patients get excluded from some portions of the star rating. What this means is that if the agency itself is not certified, then they don't get a star rating. You want to make sure to monitor changes to things like nursing home compare and hospital compare and the nursing home 5-star rating as possible predictors of home health compare changes. And again, that can be done by utilizing any type of email request through CMS or through any other agency or any other marketing material where they're talking about changes to how payment reform is happening and how that's going to impact any post-acute care settings or providers. You want corporate or regional or administrative oversight of all aspects of your home health compare rating. And that can mean you have one person who monitors the OASIS, one person in charge of Medicare claims, another person in charge of the patient survey or the vendor for that patient survey. It doesn't have to be the same person. The important key there is that if it is different people, there needs to be a level of communication between those people. Those things cannot be viewed as silos and they cannot be addressed as silos because they all intermingle to give you an overall facility rating. In nursing homes, we need a 3-star minimum to stay relevant for payment for quality initiative. And down the road, this is going to be true for home health as well. So today, if you're a 1 or a 2-star, now is the time to start making those changes to a 3-star, to start putting a QAPI system in place so that you can improve your quality measures or review your process for sending information to your third-party vendor for your surveys. Do you have a good vendor? Is the information getting to them appropriately? And if you're a 3, 4, 5-star, you're either looking to maintain that, improve it, and certainly not lose it. And you want to become familiar with the home health compare data pages. And that means just spending some time on there, playing around with the filters and playing around with dates and parameters and things that it can give you. It can really be time-consuming to do that, and sometimes you can get lost in that data. But if you take it in small pieces, you as an agency or an organization look at one of your quality measures that you feel you could be doing better in and just use the data pages to view the information on that. An agency can utilize Home Health Compare to analyze information and should also utilize the information to structure a proactive quality of care and business plan rather than being reactive to outcomes. Staying ahead of quality is only going to be beneficial in the future as quality is the basis for payment in post-acute care settings. These next couple of slides are going to be resource slides. So access to the OASIS item sets, the MDS item sets. If you click on those links, it will also bring you to the manuals for those particular assessment tools, the Nursing Home Compare site, the Home Health Survey site. the Home Health Compare general website, the public face of that website, the Home Health Compare database site, information on the Impact Act and the post-acute care change and where things are going and what we can expect in the coming years for that. The Home Health Quality Reporting Program information, Home Health QAPI and what the expectation and anticipation of that will be for agencies and how they can implement that can be found on this particular link. And again, the patient satisfaction survey information. So at this time, I'm going to turn it back over to Heather for any questions and answers.
Thanks so much. At this time, we'll move into the question and answer session of today's call. If you have a question, please use the chat feature at the bottom right corner of the screen. We did have a few questions come in during the presentation that I'll go ahead and address now while we wait for additional questions to come through. Why is it necessary to have at least 20 episodes of care to receive Home Health Compare star ratings?
Hi. So it's necessary to have the 20 episodes of care because without 20 completed episodes of care, they don't have enough data to calculate the information that would be in those quality measure components. So you need a minimum of 20 completed episodes of care to have enough data to be put into that calculation, which is a very long, drawn-out calculation, to give you a star rating.
Great. Thanks so much for the clarification. What is the best place to start to analyze the ratings for my agency?
So the best place to start in analyzing ratings for your particular agency is going to be pulling your 5-star data report and looking at your numbers. And that should lead you to a couple of questions. One, either you're going to think the numbers are very inaccurate, which is going to lead you down a path of figuring out why that information is inaccurate. Or if the numbers are accurate, how do they look in comparison to the state, national, and what aspect do I need to fix first? If you have great quality measures and poor patient survey, then patient survey should be the first thing that you're addressing from a quality perspective, and vice versa.
Great. Thank you so much. It doesn't look like we have any additional questions, so barring anyone submitting any questions while I finish out this, I can go ahead and close us out. So if there's no other questions, I'd like to take this time to thank everyone for joining us during today's webinar. I'd also like to thank CliftonLarsonAllen for their continued partnership, especially our presenter, Jillian, for sharing her expertise, time, and commitment to making this a successful program. Thank you again for your participation, and I hope you have a wonderful afternoon.